our OB-GYN called me too in Texas, and he said, hey, we do believe this is cancer. And I would say my main emotion, I mean, aside from obviously just the gut wrenching heartbreak of that, or just, the sadness of that, I was more angry, I think. And I was more angry because my cancer was stage 1. My mom's was stage 4B, the most severe of any. And so I was furious because in my mind, I'm like, why wasn't it me that had to fight that stage?
My name is Michaela, and I was diagnosed in March of 24. With ovarian cancer. When I went to the bathroom, I used to get some pain on my stomach. And I didn't really know what it was. Then, of course, they're going to check for ITU, and that was not it. So, no, UTI, not ITU. And then we went to a gynecologist, and he said, I need to do another test. And then they did the test, and that's how they found it.
Yeah, and I can probably add some more to that. I mean, my mom had been complaining about a side pain for probably a year, 2 plus. And they had checked her for, hernia. They had checked her, they did like abdominal stuff. Because they even did a scan, maybe like 2 years before all of this, and they didn't find anything at that time, but she was going to all the different doctors, trying to get checked out. And it just was basically shrugged off as, just one of those fluke side discomforts. But it was on her right side, which is, part of the area that they found some of the stuff at eventually. We don't know if it was exactly related, but I would say that she was having some weird discomfort then. And even with the urination, it wasn't while she was peeing, it was after, which was what was so weird. And I think right before we finally were like, no, we've got to go to doctors here. We're going to push to be seen. She had a episode where she went to the bathroom and we heard her because of the pain. Because she just kind of went, in the bathroom. And her husband and I were both like, what's going on, So that's when we were just like, I don't know. Also, you were always talking about your abdomen was feeling like it was starting to get larger.
Yes.
Yeah, she would always go, does my stomach look bigger? She didn't have ovarian cancer tends to have abdominal swelling as one of the things eventually. She didn't have it to the point where a lot of people did. It was very, very mild, which is why it was hard to even associate it to something more serious other than bloating, like regular bloating. But she did complain about that too. So we actually didn't just go to the gynecologist. We also went to the gastroenterologist. So we went to both simultaneously within a few weeks of each other. And both of them were doing tests at the same time that ultimately led to her diagnosis. Being that I had cancer, not even a year and a half before that. And I also was overlooked and had to fight to get the scans that I needed. I would say definitely, I've always been an advocate because we also took care of my grandmother 10 plus years with Lewy body dementia. Advocacy was a big part of that, to get her help and to make sure that she was recognized because a lot of people were writing her off very quickly back then. And she was still capable of a lot and then had a stroke too. So I think because of that already, on top of my own cancer, it was like, oh no, we're going to figure out what's going on here. And I do feel like even in my mom's case, they were very, even with the gastroenterologist, he did the standard colonoscopy and he did her abdominal scans. But if we had only gone to the gastroenterologist, he told us she was fine.
Yes.
From his perspective, he saw nothing. When my mom came out of her colonoscopy and, they give you the report because from inside of her intestinal tract, her colon area, whatever, he didn't see anything because it hadn't gotten inside. And his scan hadn't come back yet, the actual abdominal scan, which we were glad he did it because that CT ultimately confirmed what the gynecologist then also said from his ultrasound that he had done. But like, if it was only a colonoscopy because of the stomach pain my mom was having or discomfort, he gave us a green bill of health. Like, we were there and he told my mom just days before we got diagnosis, she's fine. You know, as far as I see it, there's nothing wrong. So yeah. So needless to say, we're glad we doubled up and went to both rather than just one doctor, because if we had only gone to one, I mean, there's a chance, you know, it may have not been as easily discovered. Her OB-GYN called me too in Texas, and he said, hey, we do believe this is cancer. And I would say my main emotion, I mean, aside from obviously just the gut wrenching heartbreak of that, or just, you know, the sadness of that, I was more angry, I think. And I was more angry because my cancer was stage 1. You know, my mom's was stage 4B, the most severe of any. And so I was furious because in my mind, I'm like, why wasn't it me that had to fight that stage? Why is it my mom that has to fight that stage? You know, so I think it's more that, you know, I was more angry.
The best thing was that we went to MD Anderson, to Houston. That's where we went right away. And they seen us, what, in a week?
Well, yeah, I was going to say, I think it's because I went into straight up, like, we're going to jump all over this. Like, I did not wait. Like, as soon as the OB-GYN called and said that, like, I was making calls, like, figuring out where I could go. I was going home like 2-3 days later. And as soon as I got here, I was like, Mom, you know, here's our options. Like, do we want to go locally? Do we want to go to Duke? Because that's like where I went for my cancer here in North Carolina. Do we want to go to what I would consider and what many consider and what a lot of rankings consider the number 1 hospital if we can make it work? And my mom's like, well, if we can go to the best, let's go to the best. And I had read a lot of articles about like whether to go for a second opinion or whether to go for initial diagnosis and treatment. And there was a lot of literature basically saying it's even better to go there first. So we didn't want to wait. Like they wanted us to go locally initially was kind of the plan. And we were like, no. So I called MD Anderson and I wasn't sure if my mom's Medicare travels with her across the country. And I was so happy to hear that it did. That is one thing that I'm so hopeful that it doesn't change, because Medicare, I can tell you, has been a blessing for cancer.
We started with chemo, yes. And then surgery, and then again chemo. That was the plan. The surgery was supposed to be in June, but then I broke my wrist.
But let me add to the treatment course. So initially we did a biopsy. That was the first thing. Because we hadn't done a biopsy. And that was one of the things they asked us on the phone. Had we done a biopsy locally? Because some people do a biopsy first. And that's another thing. Had we waited to do the biopsy here locally, we would have had to wait weeks probably to get that done. At MD Anderson, it was done the same day we went for the initial thing. And they were so, I mean, caring and warm. I mean, from every staff member, like you can immediately tell that everyone there helps cancer patients because that's all they do, right? So it was first a biopsy. The biopsy that was probably one of the hardest parts because we had to wait like 14 days for the results to come back. And then even when they came back kind of inconclusive. They were assuming it was probably high grade ovarian cancer, because when you have ovarian cancer, you can either have high grade or low grade. The treatment you're going to get depends on what kind you have. And unfortunately, with my mom, they were never able to confirm for certainty which one it was initially. But the doctor, based on her professional expertise, and not just hers, because that's another thing at MD Anderson, they don't really make any decision in a vacuum there. They have a huge medical committee. The doctor has to present your case. All the other specialties are there. They then all review together what they think the best treatment would be. And then they had this big meeting with her biopsy results and all her imaging. And then they made a collective decision that the best treatment course for her would be what's called neoadjuvant therapy. So starting with chemo, 6 to 9 rounds, then her surgery, and then more chemo. That was the decision at that point. And that's what we started with, and that's what we did. Along the way, when surgery happened, because of how much tumor was left in my mom's body and what it looked like, because with high grade, it can be dispersed everywhere in a lot of small pieces, very difficult to find. Whereas with low grade, it's more like discrete in like little pockets, almost like little golf balls in different areas. The doctor actually said when she opened my mom, it looked like there was low grade mixed in with it because hers was actually discrete growths. The plus about that was that she was able to remove them, even more with confidence than she thought she would have been able to with the high grade. When her surgery was done, which was an 8+ hour surgery, 3+ surgeons, all these possibilities of horrible things that could have happened, or even side things that they would have had to do, like removing her spleen or her coming out with a colostomy bag. None of that happened. And the doctor said, we got it all, after surgery. Now, ovarian cancer has an 80 to 90% recurrence rate, which I'm sure we'll talk about that in a minute. But, by all intents and purposes, the surgery was successful. And then my mom picked up chemo a couple of weeks later. Like she mentioned, we had to delay surgery because of her breaking her wrist. That's something else we can talk about there. That pushed her surgery from June to September. That was a whole thing. And now we just have one more round of chemo, when she'll ring the bell, but then she's actually going to be moving to infusion for essentially almost like a maintenance that's going to help delay.
That's immune therapy.
Yeah, the inevitable return of likely the ovarian cancer. So that's kind of the whole gist of her whole treatment plan.
My recovery was great. I was going to chemo and through the surgery with no problem. And it would have stayed like that. And then I had to go back in the hospital. And they found fluid in the lungs.
Around the lungs.
Around the lungs. And so they were going to drain it. And all that brought back to me now is my anxiety and panic attacks. Yeah. And that's what I deal with now more than with my cancer.
Yeah, like my mom says all the time, any discomfort, any feeling anywhere, it's like, oh my God, it's cancer. Like that's right away where your brain goes. And that just like that hovering over you is awful sometimes. I think trying to create enough room for my mom to process everything, and also, like the word I said the other day, to wallow a little bit, because I think that's a challenge for me, because I am a very, very positive, optimistic person. It's kind of what's helped me survive really our entire family is like that. It's not even just me, like our European family is like that. We're very resilient, right? And so I tend to always go into fix it mode and how can we make the situation better? And immediately want to come up with a plan. And that translates, I think, sometimes to not necessarily leaving enough time to just feel kind of sorry for yourself, or just like be sad. And I think that has been the harder part for me, because as my mom's anxiety and panic has gotten worse, which I have to say, my mom's been an absolute warrior through this entire thing. And I do feel like the reason the anxiety and the panic has now kind of come out and really reared its head, it's for two things. I think, first of all, my mom is navigating a lot. And for her to have carried it this whole time without any kind of panic attacks, because she literally didn't have any all the way through surgery. And then she was admitted like for 4 days or so and had to have a, now I forgot the name of it, thoracentesis, when they actually go in with a needle and remove the fluid. So all of that, I think, finally popped like the lid off of already boiling pot, right? Because it was like so much unexpected coming all at once that it was like, it just felt like losing all control of anything. And that like took my mom's, just her anxiety and panic over. And she did have a psychiatrist and still has one, because that's another thing I think is important to mention. Like, it is good to have someone to talk to. And if you have been using medicine, or maybe you need medicine for those kinds of things, it's definitely good to have someone that you're disclosing what you're processing outside of your family. So she did have someone, but she was managing it so well. She wasn't heavy on medication or anything. And so when this finally happened, her medication wasn't enough. Right, Mom? Like,
Yeah.
at least the dosages she was on,
Well,
it
it
wasn't
really
enough.
broke me when we were there the last time, the 5th chemo.
Yeah.
And she came with that I need infusion every 3 weeks for a year.
I will say too, with the bell ringing,
that
it's
was
bittersweet because my mom,
in my head was when I ring the bell. For me, it was
For
that
what?
was it.
yeah, like that's kind of because it in her mind, like, because our doctor, our surgeon is amazing. Like, the whole medical team we work with is amazing. And I definitely say anyone that wants care, go to MD Anderson. They're amazing people. But the last time was the first time, I think, especially after surgery, where she was candid to the point where it kind of readjusted our expectations. And that honesty was basically like, it's not a matter of if it comes back, it's a matter of when. And even now, you're not out of the hair. Like, you'll do your last chemo, but we're going to need you on this other drug. And by the way, it has like 8 different side effects that are all horrible, including a stroke, a heart attack, increase for blood clots, high blood pressure. Like, I mean, you name it. It was like all these things. And then you get to a point where it's like, well, what do you do? Like, do you treat for the cancer and then worry about all these other things? Like, for the cancer that's not even back yet, do you take your chances? So I think, yeah, that's where this part's a little murky and hard, because I don't think there's any one necessarily right answer, because nothing's really guaranteed. We don't know what happens from here. But I think that's what's so hard, the uncertainty right now.
I don't think I changed. I only changed because of my panic attacks. That's why I changed. Like I said, when we were there, I walked 4 miles every day.
She did.
Between the chemos and with the surgery, 4 miles, and was right away up.
Yeah.
I didn't have no problem.
She's been a rock star. Like, she really has.
Yeah, it threw me off that I still need therapy. That threw me completely off. And as long as I don't deal with that or get it under control, that's what I need and that's what the best for me, I will not get over these attacks either. Because I wake up and the anxiety is here. Blood pressure goes up to 170, and then I need to take a pill to calm me down. But that's because of that. So when we go next week, if we get to go, if my blood is all right, we're going to talk to her again. I'm going to let her explain everything again to me more clearly. And if there's any other chance, I looked up, there are like 3 more medications. It will be different if I get any, I mean, I'm going to try it. I'm scared to death of it, but I'm going to try it. And maybe it helps when I feel that it helps. Maybe then I'm going to be fine. Then I'm going to get that hope back. Right now, I don't have the hope. That's the problem.
Yeah, and I think the side effects scare you too, because we should point out, my mom had a heart attack already in her life. So the idea that a medication is going to drive her blood pressure through the roof and can cause a heart attack or a stroke, and then my grandmother had a stroke, it's a very scary water to navigate, because we don't know. So but we have to almost trust in the expertise of her surgeon, and then also the research we're doing, and then kind of just take it one day at a time and see how she does with it.
That the pap smear is not enough to be checked. That you need a CT, not even a exam by the doctor, or even that what they call
Well,
that
ultrasound. The
ultrasound.
ultrasound can help. It depends.
Yeah, it can. But that was only because she did it from the top.
Yeah. Yeah.
Remember, she made a mistake.
Yeah.
I was supposed to get it from the bottom.
Yeah.
Yeah. And then they made somehow a mistake. And when I got there, the lady did it on top here.
Yeah, it was supposed to be a transvaginal, and then they just did a pelvic ultrasound.
And that's how they found it. And that's how I say a normal pap smear don't do nothing for you.
Yeah, I think that's probably the biggest misconception that women have, right? I think a lot of women don't understand that it only checks for cervical cancer,
Yes.
pap smear. It's the whole purpose of it. And that's also why they don't recommend it as often anymore, because there hasn't been like a direct link to like an increased ability to diagnose cervical cancer because of it. But like, people don't realize there is no test for ovarian cancer other than a combination of things, including your CA-125, which is not a marker that you can use as like an early detection thing, but in combination with a CT scan or a pelvic ultrasound, and then your other blood work to kind of see, do you have other things that are wonky? Because I will say, even in both of our cancers, our blood work was off, and you just kind of know something is off with that. Like that, I think that's the main message. That's probably the only message for ovarian cancer. Like, it's just, I tell people all the time, if you feel like something is off, particularly as a female in your reproductive area, go and get checked. And if your physician is not listening, go find another one. Like, I'm so serious about that. Like, that we've learned it, we've seen it. I myself just had a hysteroscopy done because I was having some abnormal bleeding. So of course, with my mom's ovarian cancer, we're like, oh my gosh, do I have something going on now? And my doctor, my OB-GYN, did a CA-125. He did a hysteroscopy to be able to take sampling from my endometrium, which did come back normal, thankfully. But those are all things that we're trying to stay on top of now because of everything, that we've seen here.
You have to get checked out by a doctor. I mean, you have to go on your own, not wait. You go every year and get your stuff checked. And you tell the doctor that's what you want. You want him to do this and this and this, and not what he wants to do.
Like, even if you don't have any set symptom, right? I would still say keep getting checked out. Like, that's just sometimes it takes years for people to diagnose things, especially smaller growths that might be hidden in certain areas. So that's a big one. And I think my second thing I would say too, it's like there's definitely a lot of places and people that are willing to provide support, and that can provide support however much you want it, right? Like, I will tell you, my mom and I, we realized in our fight that there was benefit to connecting with others that are fighting cancer too.